The new Oshkosh Corp U.S. Postal Service vehicles won't be made in Oshkosh anytime soon. When asked if it was reconsidering its decision to manufacture in South Carolina, in a statement to Fox 11, the company said no. Facility preparations are well underway to ensure Oshkosh will meet the strict timing requirements of the program. Oshkosh Corp says it's just not feasible to have the trucks made here in Oshkosh because more space is needed. We're talking about 825,000 square feet, or more than twice the size of its largest Oshkosh facility. The company says it looked throughout the state of Wisconsin and other states for an existing building that was large enough, but Wisconsin didn't have a single building that would meet the requirements. What's more, it says the strict timing requirements of the program didn't make building a new facility an option. Oshkosh Corp says it remains committed to the city of Oshkosh, its facilities, and most importantly, the people of Oshkosh. It also says it's important to note that no jobs will be lost with the manufacturing in South Carolina. And in fact, they plan on building a technical center that will be housed here in Oshkosh, staffing more than 100 members. As for the recent political back and forth about its decision, the company said, "We're focused on meeting the needs of our USPS customer to replace their fleet of 30-plus-year-old long-life vehicles."
So what do the local case numbers and hospitalizations look like today?
Yeah, I think at this point we're on a clear trajectory downwards, particularly with the new number of cases. We've seen our positivity rate decrease over the last several days and weeks. That has led to a decrease in the number of new cases reported each day. And hospitalizations are looking much, much better than they had been just about a month ago as well. For the state as a whole, we actually have about half the number of people in our hospitals as we did in January. Locally, it's maybe down about a third, so not quite as good as the state as a whole is seeing, but clearly a much better position than we had been in January.
Good news to hear that the numbers are dropping. Is it because more people are testing at home and not reporting the results?
You know, that's a great question, but it doesn't seem that that is the case. We've seen our hospitalizations decrease, particularly the new hospitalizations each day seems to be dwindling very quickly. Our positivity rate is down too for people who do seek testing at a testing site. And I think all of those things suggest that the actual case burden in our community has decreased.
When it comes to masks, earlier this week you said we should err on the side of caution when it comes to unmasking. Can you explain?
Yeah, absolutely. So we know that masks are effective. Even a new study that the CDC has presented indicates that even a cloth mask can decrease the likelihood that you catch COVID by about half. Of course, if you wear a higher quality mask than that, either a surgical mask, a KN95, or even an N95 mask at this point, that reduction is even more significant. Even though our trajectory looks very good, we still have a very high burden of disease with a lot of what we call community spread, meaning that when people get COVID, they don't often know who it exactly came from. And that contact tracing, is really impossible at this point because the disease burden was so significant that the chance that you encounter someone at random just doing your daily activities was very high. So because of this and our high case numbers, the likelihood that you see someone at random, like, just going to the grocery store who is infected with COVID, masking is still an important risk mitigation strategy. By this point, I think we all know that COVID isn't just influenza, and we know that COVID-19 has been incredibly impactful on all of our lives for several years now. And I think that masking remains an important tool at the right point to continue to decrease that impact that COVID-19 is going to have on us. And it's clearly going to make it even sooner that we get back towards normal and just make that trajectory downwards happen at an even more rapid pace.
You mentioned back to normal. Will there ever be a good time, do you think, to stop wearing a mask?
Yeah, of course. I think we're certainly headed in that direction at this point. Like people probably recall last summer, people had stopped wearing masks for a period of time before the Delta variant came about, which was just incredibly easily to be transmitted. But, we're clearly heading into an area again where masking is going to be less of an important tool. Masking is going to be important when we have a high case burden in our community. it's going to have a greater impact on our lives and improving things. And when cases are very rare, it's going to clearly have less of an important tool. But from a purely mathematical sense, that transmissibility part of the equation is an exponent. So even a small change we can make to transmissibility has an exponential impact on our lives. And that's why masking has been so important.
Doctor, Wisconsin will probably reach 60% fully vaccinated in the next few days, but many of those people got their shots a year ago. DHS doesn't list the percentage of people who have received a booster or how long ago they got it. So how useful is the information on the dashboard at this point?
I think it's very useful. We know that even though people maybe had not been vaccinated since March of last year, that vaccine, although wanes over time, continues to have a significant impact on all three of the outcomes we really look at. We know that it's going to decrease the likelihood that you get COVID. It continues to protect against COVID and has a prevention measure that's key here. We know that it prevents people from needing to be hospitalization. In fact, we're looking at almost a 10-fold reduction in vaccinated compared to unvaccinated. And it's about a 14 chance decrease in the likelihood that you die from COVID-19. So we see favorable outcomes for all three of those measures, sort of regardless if you've had your booster shot or not. Lab studies have shown that people who get a booster have an increased number of antibodies in their system and a more robust antibody response if they do become infected with COVID-19. So the protection for them likely is significantly greater. But sort of, regardless if people have had that booster or not, they still fare much better than people who are unvaccinated. And that's reflected both in the data the CDC and DHS puts out, and it also is reflected in our own experience in the emergency department and taking care of people in hospital.
Do we just have to learn to coexist with COVID?
Yeah, absolutely. I think it was just 3 months after this whole COVID thing really began, Secretary Azar came to visit us here in Greenbay, because that was, sort of our motto as healthcare providers and members of this community. I think, a large part of our mission is to keep our community healthy, prevent suffering. And we know that people's livelihoods are an important piece of that. And very early on, we sort of operated with this idea that we need to help our community coexist with COVID. And that was recognized by President Trump and his team when Secretary Azar had come to visit us here in Green Bay. We know that there are risk mitigation strategies that can help us live lives as close to normal as possible while we continue to navigate this pandemic. And the more people in our community who follow those recommendations, the more effective we're going to be as a community in preventing suffering while having as close to normal lives at this point. I don't think I need to mention what those prevention measures are. People have heard it over and over and over again. But I think for us to coexist with COVID, we need as many people as possible to sort of mask up when the public health officials say transmission is very high and this is a key measure. And when things are looking pretty good, our public health people who, dedicate their lives to helping us navigate things like this, then maybe we can let up a little bit. But, certainly we want to err on the side of caution and be a bit conservative with those measures because we don't, sort of want to get the cat out of the bag. We want to make sure that we keep things low so that people can, be happy and do their things and, go to Door County this summer.
Well, okay, a little trip to Door County might be on some people's plans for spring break. It is right around the corner. What are your recommendations for people looking to take a trip?
I think first, if you're traveling internationally, I'm sure you have looked up the requirements of your destination and any requirements for return to the United States. So, clearly you want to know those and be ready to have a backup plan if for some reason you do contract COVID-19 while traveling. You want to make sure you know exactly what that plan is going to be, whether it's having travel assurance or some way to get out of the country you're currently in. And again, if you are traveling, it's, probably a relatively good time with case numbers declining fairly quickly, particularly for those people who are vaccinated against COVID or had a COVID infection in the last few weeks or months. they also have a high degree of protection against COVID-19. But following those public health measures are going to ensure you have the safest trip possible and don't return and need to be off for another week or two from work.